With the current outbreak of the H1N1 Pandemic Influenza, business continuity planning is critical to protect employees' health and safety, as well as minimizing the negative impact to businesses and the society. While organizations may have already taken appropriate preventive measures to minimize the risk of potential employee exposure, illness, and the spread of H1N1 pandemic influenza in the workplace, contingency measures need to be put in place to meet the challenges of possible mass infection and to ensure business continuity. In this Meet the Expert seminar, Dr. Goh Moh Heng of the BCM Institute will share their H1N1 pandemic influenza planning, which includes business continuity planning, workplace safety and health issues, and administrative controls, human resources policies, employee assistance services and actions to take when a case of H1N1 influenza virus is confirmed among employees.
My name is Dr. Goh Moh Heng. I'm the President of Business Continuity Management Institute, or BCM Institute for short. In today's session of the Meet the Expert seminar, I will be talking about the corporate guidance for H1N1. Now, as the world moves towards containment to mitigation, which is actually part of the World Health Organization requirement since 7 July, WHO informed all countries that they are no longer required to submit a regular report to them. As such, there will be no numbers as to who is infected within each country. Okay, so what we are going to do is most of countries has now begun to track the H1N1 outbreak through its influenza biosurveillance program. And this program is just to report the number of confirmed cases still in the hospital. In this seminar, what we're going to do is we are now in the situation where H1N1 influenza A has become endemic among the global community, in which is now infecting the community at large, and this is a tremendous concern to most organizations, especially to the corporates. Now, what we're going to do today is actually to focus on two main issues. Today's presentation will focus on how organizations can move from a containment to the mitigation mode. Now, the general challenge that we have is organizations are unable to adapt to this change. Reason is because they are no longer able to apply their traditional containment procedures, as government has stopped checking, conducting temperature checking. So what we are going to discuss today first will be how organization can manage the outbreak of the H1N1 within the organization, starting from the containment or starting from the alleged outbreak to the time whereby the alleged victim is sent to the hospitals or rather to any clinic for immediate attention. The other part of this presentation will focus on the challenges that's being faced by the human resource team. This is perhaps the most difficult time because the human resource professionals will need to readjust or reconfigure their human resource policy to adapt to the impending changes in the H1N1 outbreak. We look forward to seeing you in the coming Meet the Expert session.